Namaskar. I'm Mrs. Manjusha Kelkar, founder of Breakthrough Higher Education. Through this platform, we try to track journey of people in medical field. Right now, we are concentrating in the specific field of medicine in MBBS stream. Because as we know, there are many streams related to MBBS, related to medicine, but we are specifically handling MBBS at this point of time. So in the series, first you remember I have interviewed a student who is studying in Philippines. Next in line, I would like to interview a professional who is already established in her field of medicine. And I want to track the journey ahead after MBBS, the UK perspective. So here is a doctor whom I know from her childhood days. Due to her family background, her parents, her parents were into the medical field, paramedical and medical field. And so she always aspired to become a doctor. There was never a second thought, like what I would like to become. There was nothing like that. There was no question. It was always all set. She wanted to become a doctor. And I personally know her as a somewhat laid back person, quite non-flashy about her intelligence, because that's what I have observed. She's quite non-flashy about her intelligence, and yet very meticulous with clarity of thoughts. So without further delay, let me introduce Dr. Aditi Pandit. Hello, Dr. Aditi.
Hello, hi.
So how are you and where do you stay right now?
Hi, I'm good and thank you for your kind introduction. I'm living at the moment in Birmingham, near Birmingham in UK. So I've been here now since 2003, so quite a long time now settled here.
Almost 17 years you are there.
Yeah.
So I know that you live with your husband, who also is a doctor, and 2 kids, right?
Yes, that's right. Yeah.
Okay. So today we will be tracking your journey from India to UK MBBS route. So you did MBBS in India.
Yes.
Back in I think 2001.
Yes, I finished my MBBS and internship in 2001.
Okay.
Yes.
And then what happened after that? Because usually what we see in medical field is people then appear for their postgraduate examination, and the next further thing, what obvious thing everyone does is appearing for their or trying for their PGs.
Yeah.
And there are 2-3 paths. People either go the diploma way or the MS way, MD way, or many things happen with people out there. What exactly happened with you after your MBBS?
Right. So I did my MBBS. After that, we had to do entrance exams to get a PG seat. So I had given a few entrance exams in that year. And I was working in 2 kind of private hospitals for 6 months to a year. So at Nanavati Hospital in Parla first, and then at Bombay Hospital, trying to do a surgical experience there. So I was doing that and giving my exams at the same time. But life probably had a little bit of a different plan for me, which I had not given a lot of thought about, but I did go with the flow then eventually. So at that time, I met my husband, who was already in the UK, but was visiting India at the time. And it completely changed the whole route that I was planning to take and do my post-graduation in Bombay. So then I had to kind of shift base and start thinking, what do I need to do if I have to go to UK to study and get my further qualifications? So I think this was a long time back. So I think some things might have changed, but there are some things which are still probably the same. So I had to prepare for my IELTS, which is an English exam, which I did back in India itself while I was waiting to get my visa and come here. And then after that, I had to give the PLAB exam, which has got 2 parts, where one is the MCQ part of it, and the other one is like the stations and like a Viva and seeing patients and making decisions like that. So yeah, so that was my journey.
So,
which took about a year.
So you took about a year to do complete all these things, and I think you went for a short crash course coaching for PLAB 2,
Yes.
and PLAB 1 is MCQ,
Lab one is MCQ.
as I understand.
Hmm.
So during all these things, how was your family life going on? Like, you were married as well, you were studying. How difficult was it for both of
So
you?
for both of us, so I think, yeah, because it was just the two of us, I think to me it was not that difficult. I can usually cope with a lot of different scenes and scenarios, so it was quite exciting for me. I think because all I had to do was study and just be at home at that time for that 1 year, and just get to know the country and see how things work and how you go and do your shopping, and learning all these different things, because I wasn't driving at the time as well, so that was a little bit more of a challenge. So that was another thing I had to do, and I think I found the driving test much harder than any other medical exams that I have given in the UK. But
That's
yes,
good.
so that was the journey that I had in that 1 year when I was here. But yeah, but it was a nice place to settle. You have to get used to the cold, which I was not at
Mhm.
all used to. But yeah, with time, then everything's been okay, settled down.
Great. So, what next? After PLAB 2, what next?
So after you've done the PLAB 2, then you can technically apply for jobs. But before you get a job, they want you to kind of do a little bit of observership or apprenticeship in a UK hospital, just to get to know how things work, what are the different grades of the doctors, nurses, physios. It's such a big team, and if you've got no kind of experience, they prefer you to have a little bit of experience. So I had to kind of find hospitals locally where I could travel on the train or the bus, and I had to write to the head of the departments to see if anybody was willing to give me just like an apprenticeship or observe. This is not paid, so you go there and you spend the day like a normal working day on the ward. And you try and look at how things work and how the departments interact with each other, how are the referrals done. So basically, to get a knowledge of how the system works inside the
As
NHS.
an insider, you are observing
Yeah, yeah.
because you
So,
are not
and
allowed hands-on, I hope,
no,
during your
you're not allowed
observership.
to kind of have any direct interaction with the patient. I think if once
Mhm.
they get to know you, they might allow you to clerk the patient, which is basically taking a history and writing things down, like they would let a medical student do, maybe. But it's very much consultant dependent. If they're happy and confident with you, they will do it. Otherwise, you are just standing there and they will just ask you questions. So, yeah, that's how it is.
So, how important at this point of time when you were very new into the country, you were just getting yourself accustomed with the difference in the cultural scenario and everything else. How important do you think communication role is there? How
Yeah.
important role
So I think
communication
it's
plays?
a very different way of communication, I found, because in India, like, doctors are gods basically, and they, whatever they say, everybody will listen, everybody will be like doing whatever they want you to do. Whereas here there is a lot of there's no kind of grading of, so you're not on a higher pedestal than anybody else. You are all at the same level, same team, and everybody's opinion is valuable and it counts, because it's a very much multi MDT kind of approach. So there are lots of different people involved in that team. So yeah, so I found that quite fascinating, that everyone's opinion counts and everyone is, and they do have really good advice to give you, because it's coming from a different perspective. So I thought that was really something that was an eye opener for me. So it was quite nice actually to not be
Yes,
the final word.
yeah. I've heard stories whereby sometimes it so happens that nurse and ward boys and these people, they are in continuous contact with the patients. So
Yeah.
sometimes when they give you some advice, it really matters. Or when at least you can give a listening ear to what they have to say,
Yes.
because
Yes.
24/7 these are the people who are in continuous contact with the patients.
Yeah. Yeah.
Doctors may come and go eventually, but these people are always there with them. So
Yes.
yes, what
Yes.
you get.
Yeah. And also, I think as a junior doctor, when you're just starting, they are the ones who guide you and they tell you what needs to be done and which forms to fill. And, so I think it's really good to be on they for them to be on your team. That's
Yeah,
a good thing.
on your side of the table rather
Yes,
than the opposite side of
yes,
the table.
yes, it
Yes.
does help.
So,
Yeah.
okay, so you did your observership, and after that, you started applying for different jobs.
Jobs, yes.
So, what
So
it
there are
is
different
like?
kind of jobs depending on where what you want to do. So if you want to be a physician, you'll try and apply mainly for medicine and post
Mm-hmm.
in medicine. So normally to get your qualification, which is the final thing that you're aiming for, is your exams like your MRCP, MRCGP, whatever it is you want to do. You have to go through so many years of training, and it's called
Okay.
as, you can either do just ad hoc jobs, which is like 6 months of medicine in this hospital, 6 months of surgery in that hospital, and that all adds to your experience. But what you really need is to get a training number to be able to become maybe a consultant or a final GP at the end of that, and that's called as a rotation. So you
Mm-hmm.
apply for rotations as well as you apply for whatever jobs are coming, because the first time you're stepping in, anything is fine, it's great, it's an experience. So yeah, so you apply for that, and there are different rotations for different specialities, how you go through.
Mm-hmm.
So I applied, I think, in that year for over 120 jobs, which are normally advertised in the BMJ magazine, which is a doctor's educational magazine. And out of the 120 applications, I got 3 interview calls. That's it.
Oh,
So yeah,
yeah.
so I was kind of mentally prepared that this is going to take a long time. So you have to be
Mm-hmm.
patient. Uh,
Mm-hmm.
but in that as well, so when you are starting off new, you have to be ready that you can go anywhere in the country, because it is more
Mm-hmm.
important for you to get your foot in, to get the experience. Because when you start applying, they will ask you what previous experience you have. And I remember having this conversation in the interviews, and I said, unless you give me my first job, I'm not going to have an experience. So, it's up to you whether I'm going to get an experience or not. So, yeah, so they can be in different parts of the country, and you have to be ready to move around, which is what a lot of people do. So I was very fortunate because I got through all the 3 interviews that I gave. One
Mm-hmm.
was about 100 miles from where I was living and my husband was living. And the other one was a rotation that I was offered for general practice. And that was a 3-year rotation, and it was in the Midlands. So to me, that was a no-brainer, because I was interested in medicine as well, and general practice covers a lot of different types. It covers a bit of everything. So it's a jack
True.
of all trade kind of thing.
Mm-hmm.
So yeah, so I went for that, which was a straight 3-year rotation, and in Midlands, which helped because I didn't drive or do anything at the time. And I worked in all the big hospitals in Midlands, covering the big departments, so like A&E, gynecology, and elderly care, and pediatrics. So when I was training, it was a 6 monthly rotation. So it's a long time to be in one department. These days now they've shortened it down to 4 months.
Okay.
So they go through more departments than what I did. So
Mm-hmm.
yeah, so that's how I did my 2 years. And then the final year of your
And how
rotation.
hard it was, because
Yeah.
you have to travel and you don't have a driving license.
Right.
If then what?
Yes.
Then you have to
So
walk
I
down.
think my hospital jobs were okay because you've got very well connected trains and buses and things. It was a long day for me.
Mm-hmm.
But when you are on nights and things, they used to give you a bed if you want to stay
Mm-hmm.
over, because sometimes A&E shifts used to finish at 2 o'clock in the morning. So I was not going to travel home at
Mm-hmm.
2 o'clock on my own. So I used to sleep in the hospital and then come back at about 7 o'clock in the morning. So it has been interesting, but I think when you enter the field of medicine, I think you're used to hard work and you're used to shifts like that. So you kind of, to you, that is quite acceptable. And I was quite young. I could do all that at that age. I don't know if I can do it now, but I could do it then. And I didn't have any responsibilities. I didn't have children. So I was quite happy to just enjoy that experience, because it was such a lovely learning experience. You're learning, seeing so many things.
Hmm.
And yeah, so I really enjoyed that. I really enjoyed
So
that.
I think you were correct person at the correct place at the correct time.
Correct. Perfect. Yes, that's right. That's right.
So yes, we were going back. What happened in your third year?
So in the third year, we are basically based in the community, which was for me was in the general practice, which was local,
Mm-hmm.
again within walking distance from where I was living. So it was a godsend.
Mm-hmm.
Now the difficulty or the challenge I had is at that time when you're in general practice, you have to do home visits. And I was
Okay.
not driving. I was struggling
Mm-hmm.
with my driving test. So I kind of had a word with my trainer, and I said, "Look, I'm okay to walk about 3 miles. So give me whatever visits are within 3 miles. I'll do that." And he said, "Okay." So yeah, so I was walking for half the year. I used to walk 3 miles to and fro for my visits, which was again okay. I learned how to deal
So
with
it
the
kept you
snow.
fit and fine. Maybe
Yes,
you
it
daily
did. It
walking.
did. It didn't feel like it at the time because when it's snowing,
Hmm.
and then so many
Yeah.
things you have to learn that I didn't know that, it's much more comfortable to walk in wellies, which are like
Hmm.
gumboots, when
Hmm.
you're in snow rather than
Hmm.
walking in your normal shoes, which get all
Hmm.
wet
Hmm.
and frozen. And so, yeah, so you learn a lot of things. So you learn a lot of things. So, yeah, so I
So
did
this
that.
is this thing is a bit different for me. So what happens when you go for a house visit?
So it's usually for people who are either in a nursing home or a care
Okay.
home, or who are quite old or unwell. So they can't come to the surgery. So you go and do a normal, what you would do in your own surgery, an examination history, and come up with a plan, but you do it in
Mm-hmm.
their house. So you have to carry your own medical kit with you wherever you
Mm-hmm.
go. So you have a
Mm-hmm.
bag with everything that you need. Uh,
Mm-hmm.
so yeah, so it is
Okay,
quite
so
something.
it works this way that you are visiting the elderly people
Yeah,
who just cannot walk up to
that's
you,
right.
maybe,
Yeah.
and
Yeah.
everything of this is under NHS,
It's all
National
under
Health
the
Service,
NHS. Yes.
NHS.
So and when you're
Okay.
training as well, so yeah, it's all under the NHS. And then
So, which year was this now? In your final year,
this
what
was
was this
my
year?
final year was 2006, 2007. In that year, I was in my
Okay.
registrar year. And so at that time we had to do this MRCGP exam, which is the Royal College exam to get your final to go on the register as a general practitioner. So again,
Mm-hmm.
that has got an MCQ part, and then it's got its Viva and its stations where you go and you're assessed there. We also
Mm-hmm.
used to have a video consultation where you have to record yourself doing a consultation with a patient, and there's got lots of criteria that you have to tick to be able to prove that you're a good at your job, or you're covering everything that a good doctor should. So yeah, so that was also quite challenging because you have to have the video setting and all that, but everybody does it and you learn. I'm not sure whether they still do it, but I think they might be doing it. But yeah, I had to do it when I was doing that. So yeah.
So, when in this journey, when did the kids happen?
So I waited until I had finished my journey because I wasn't sure how I would cope with everything, with the exams, with the night shifts and all that. So I didn't want to take too much stress. So I think my first boy, he was born in 2009. So by then I had finished my rotation and I was looking for jobs. So I was doing a locum jobs, because when you finish and you're on the other side of your rotation and your exams and everything, you're a qualified general practitioner. You can go down 2 3 ways. So you can either be a locum, which
Okay.
has got its own pros and cons. So you can decide how much you want to work, which days you want to work, how many hours are you going to work. The negative side obviously to that is you don't have any sick pay or annual leave or no pension contributions and things like that. So you have to do all that bit into take it into consideration. But to me it
Mm-hmm.
suited my lifestyle because I had a new baby. So, and you're alone here, so it's just me and my husband, and he couldn't do what I was doing, so he had to work full time, and as a consultant. By then he was, so I think that suited me quite well at that time. So I think I was doing locum work for almost 4 or 5 years, because that's when I had both my children. And as you start locuming, people get to know you. So then instead of moving one day in this practice, one day in that practice, they offer you a year's locum. So
Okay.
then I was at least in one place steady for a
Hmm.
year. So that helps as well to get to know the patients and the staff. It's not a new system every single day.
Hmm. Hmm.
So
Hmm.
I was lucky to get that. So I was getting kind of back to back a yearly locums in different practices, just because by then people knew me.
Hmm.
And so, yeah, so that worked out well till I think both my children were um, quite also, my son was going to school, and then my daughter was born in 2012.
Okay.
So after she was born, then I think when she started going to the childminder, that's when I took up a salaried post, which is where you work in a practice. You're mainly clinical. So you do all
Mm-hmm.
the clinical work, you see the patients, you do all the admin work clinically, but you're not in a management role of any sort. So you are still
Mm-hmm.
employed by the practice, and you just do your
Mm-hmm.
work and you go home. So I
Okay.
did that for a while, and then the next step is becoming a GP partner, where you have more responsibility. You are responsible for the people that you employ, and there's a lot of managerial role as well that comes into it. So that
Okay.
is another step
Mm.
up which you can take, which I did in last year, only last year.
Last year. Okay. So it's almost a journey of 15, 16, 17 years almost, a
Yes.
journey.
Yeah.
So this is where you wanted to reach always?
Yes, I think I was, like you said, I'm a very easygoing person. I know that when you come in this field, there is a lot of burnout as well. So you can go very fast where you want to go, and you will reach there because most doctors are quite driven, and if you have a goal, they will reach it most of the time. But I think I was very conscious that I was on my own. I had to manage two children, I had to manage a house, and I think I was the only person in this family who had the option of doing this. I think as a consultant, my husband didn't have the option of part-time job, or that is not something that was heard of. I think now you do
Mm-hmm.
have, but at that time it was not even advertised. It was full
Mm-hmm.
time consultant. That's the only option. So
Mm-hmm.
I think I knew that somebody has to take it a bit easy, just for the peace and happiness of the whole family unit, and
True.
looking at it long term as well.
Mm-hmm.
So I never was thinking that I want to be a partner or anything like that. I was just taking every year, and I was very happy doing my job, because I think that was my main thing. I loved seeing patients, and I loved doing the medicine part of it. I was not much bothered about anything else. But then I think as the children grew up, I felt that I had that time, and I was able in a position where I was like, okay, now I've done this for so long, maybe a new challenge might be a good thing. So yeah, so I took
So
my
yes.
time doing everything. Yeah.
So emotionally and practically also you were ready to take this leap. I think so.
Yes, I think that is very important, because even though
Mm-hmm.
it feels like, oh yeah, you see so many people doing it, but until
Mm-hmm.
you actually step into their shoes, you don't realize how much is going on behind the scenes. And I think that's with any job. I think when you're into it, that's when you realize actually it's more than what it says on the job description. So
The grass
I
is
think,
greener on the other side,
yeah,
always.
yes. Yeah. So if it is something that you are ready, and you have the mental space to take on that, then you should take it on. Yeah.
Okay, okay, okay. So, going back, when you were studying in India, any incident you remember, which is just engraved in your mind, not necessarily related to medicine per se, but as it is.
Uh, I don't know. I think in India, I think it was more the volume of patients that we were used to seeing. It's very difficult working in government hospitals. Just the amount of people that go through your OPD are
Hmm.
so many that I don't think. But I remember an incident here when I was doing elderly care.
Hmm.
And I think it was my first palliative patient that I was looking after.
Hmm. Hmm. Hmm.
And
Hmm.
I remember the consultant, there was nothing we could do for the patient. It was, you had to just keep him
Yeah.
comfortable.
Hmm. Hmm.
And I remember the consultant sitting down next to him, and giving him some water with a little cotton bud, because that's the only way he could take it. And that really made a big impression on me, that even when there's nothing to do, there's still something you can do
It's
to
true.
make a person
Yes.
comfortable. So I think I was very, very moved and very upset that day, but I think it's really helped me in my career looking after such patients. So yeah, there's always something you can do.
Yes,
Yeah.
the empathy
Yeah.
part of it is very great when in your
Very,
field,
yes.
your profession,
Doctor as the
especially.
medicine, as they say.
Yes,
You don't have to get
yeah,
any other, it's just the doctor.
exactly. Yeah. I'm sure looking at you, elderly people must be feeling very happy, and half of them must be relieved simply looking at your face. I'm sure about that. So, right now, at this juncture in your life, what are your goals and objectives related professionally?
Professionally. So I think, I have just entered, it's just been a year of becoming a partner. So I think that I still have a lot of things to learn and get better at doing, which you're never taught in medical school, which is things like management and HR and, the problems and the challenges that come with that. So I think I still am learning that. But I'm keen on education as well. So we do have medical students. So that is something that I would like to kind of get more involved with. So I
Mm-hmm.
think, yeah, I would try and get that in on my career plan in the next 5 years to be more involved. I mean, we do a little bit anyway, but I want to do more in that. So yeah.
Okay. So right now, what is your schedule like? How many hours do you work and how many days you work?
So I work part time because the
Mm-hmm.
hours are so long that I feel that I do need that downtime because of the hours and the intensity of the work that we do in general practice.
Mm-hmm.
So even though it feels like you're covering a lot of things, I think it's very intense. Your job, your day, working day. So it can be 12-hour day that you work because even though you see the patients at certain times, afterwards there's a lot of admin work that you have to do, catch up on the letters from the hospital, the referrals, the bloods. So that takes up a lot of time doing that. So my
Okay.
day would normally start at 8:30 with my first patient. I think COVID has changed a lot of things now. So we used to have face-to-face patients where you're given only 10 minutes per patient to see them, take the history,
Mm-hmm.
examine and sort them out, come up with a plan. So that itself
Mm-hmm.
is a big skill, and you learn that in your registrar
Challenge as
work.
well as skill, I think.
Yes, yes,
But
and
we come out with a plan in 10 minutes with a
yes.
patient is a challenge as well
It
as a
is a
skill, I
challenge
think.
because they want to tell you so much, and you
So
are
much,
already
yeah.
thinking ahead a lot when they're talking.
Mm-hmm.
But yeah, but I think as a registrar, you learn that because you always running late as a registrar because you're still uh, going through all the things very carefully, and I think it's a skill that comes with time. But
Okay.
now that's
Mm-hmm.
changed to even shorter times, which is like now we are doing all telephone consultations. So now
Mm-hmm.
we are given only 5 minutes per telephone consultation. So
Oh.
5 to 7 minutes, because some calls are easier, some calls are very straightforward, whereas others. So in that 5 minutes now, I think we have learned really in this time how to triage patients properly. Because if you make up your mind in the first 3 minutes of the story that I need to see this person, because
Hmm.
I can't make understand what's going on unless I see him and
Hmm.
put my hand on him, then
Hmm.
there's no point in talking to him anymore. You just bring them down, you know.
Hmm.
And then
Hmm.
there are a
Hmm.
few who are very straightforward, who just want some medicine. They are done in a couple of minutes. And
Hmm.
then there are some more complicated people who you don't need to see them, but they need you to talk to them.
True.
And that's where you take those extra time and you put it there, and you spend more time with these patients where you talk to them for much longer.
Maybe they need more of a counseling rather than a
Yes,
treatment.
yes,
Sometimes it so happens,
yes,
especially with the
absolutely.
elderly people.
Yeah.
And what is the roughly then if you are talking 5 or 7 minutes per patient, what is the volume that you are addressing right now?
Uh, I think you have to calculate it. Like, I think we see at least 20-25 patients in
Oh
one
my
clinic.
God.
In
Oh,
one
oh.
clinic. So out of that, I might need to call down four. Two or three of them I can send to my nurse practitioners because they are quite straightforward chest infections or something that they can easily look after. So yeah, so I think we do have a break as well. So it's not all go go go. We do have a coffee break for half an hour, and we have a lunch break for an hour, but it's a working lunch. So you're still doing your admin and
Something or the other.
things on the
Yes, yes,
computer. So
yes.
yes. But we do try and definitely meet up for coffee because you do need that little bit of break. Otherwise, you get a lot of mental fatigue by the end of the evening. So yeah.
Yeah, yeah, correctly said. There is a lot of mental fatigue when you are, and one thing when I always feel that to a doctor, nobody comes like, doctor, I am so happy today, I'm all well today, because everyone coming to a doctor will have some or other problem. So always, so the this way it's so draining emotionally
It is.
also, and
Yeah.
mentally it's so
Yeah.
draining, because then how you people in the medical fraternity, how you people deal with this type of as you said, burnout?
Burnout, yes. So I think, there are different ways of dealing with this. I mean, it depends. First of all, you have to be aware of this, and you have to be aware of how your day to day job is affecting you. Because if you're so busy in your life that you've not had time to even look at how it's affecting you, then you're definitely heading towards a burnout. But other than that, I think it's good to have different interests within your job as well. So for example, I do family planning, so I enjoy that clinic. It's not a very stressful clinic. It's more of a hands-on approach to patients. And nobody's coming to there to talk to you about how bad their day is or whatever. It's a very straightforward, we have a plan. They do try and squeeze a few things in, but it's usually nothing complicated. That helps. Education helps, because when you're spending time teaching a medical student, you're kind of going back in time yourself, and it's fun to quiz them and try and teach them new things. So again, these to me are de-stressors within the job that you do.
Within, yes, yes,
Again,
yes.
you have to be very conscious. So if you are working full time, doing long hours, and the more compassionate you are, the more difficult patients latch on to you, because you are a nice doctor. So so
It's a
you
law
have
of attraction.
so
It
you have
works.
to, yes, so you have to learn to be able to not get emotionally involved too much with this. But I think again, that is something that is taught to doctors, and they learn that in their through their career. And you do get, there are still some people who will emotionally upset you, and you will think about them when you go to bed at night. But I think on the whole, you learn to keep that balance. So yeah, it is a skill to learn over time. Yeah.
So, out of all this, which is the role of a doctor that is most appealing to you? What is that role?
I think I enjoy the pure medicine part of it. I enjoy that. I enjoy mental health a lot, because I think a lot of the current condition and the world that we live in, a lot of the physical symptoms are also brought on by stress. And like I'm saying, people are never taught how to deal with stress, or how to realize when something is affecting you to the extent that now it's going to affect you physically as well. Nobody's ever taught that. There are very few lucky people who have seen it in their family, or they have a mentor who has told them this, so they're very self aware. But most people just go through life, they are on a run, they want to reach certain goals by 20, 30, 40, and by the time they reach there, suddenly the stress of it is too much. So I find that very, very interesting, and I love talking to patients about it and counseling. So like I said, I always think there's always something you can offer, even though there is nothing in the, you've ticked all the boxes, and the book doesn't offer anything, but there's always something you can offer a patient. And I find that really rewarding when I see them kind of turn around, or when they leave the room and they say, I feel so much better after talking to you. So that's all you need. So yeah, that, I haven't really told them anything great, but it's just that talking and kind of it's just turning things around and making them see it in a different way. So I like that.
I think we missed out one point, that how many days a week you work right now?
I
With the
work,
12-hour per day
yeah.
workout, how many days you can afford rather to work with your
Yes.
family and
Yes.
everything?
So because of the children, I've always worked not more than 3 days, because I need 2 days to catch up with everything else that's going on in the house. I at the moment I work 2.5 days. The half day is never a half day, but I'm okay with that, because I know that I've got the time. I know the kids are not at home. So that's how I've planned things, that I know that on these days I will be late and I'll not be available for anything. So you can plan for those days. So yeah, so 2.5 days at the moment.
2.5 days. And at the same time, your husband is working full time.
He's working full time, yes. So
So
yeah.
5 days a week or six
Five,
days a week?
5 days a week,
5 days a
yes.
week.
And then yeah, and then even we have to be on call when I'm
Mhm.
working, and he has his own on calls, which are for
Mhm.
him 24 hours. For me, it is when I'm there, so it's half a day.
Mhm.
usually.
So
Yeah.
you have to be on call. So
Mm.
eventually, what are the challenges you face in this field?
I think challenges that you have to, time management is a big thing. You have to learn to be able to plan. So I was not a planner at all. I was a very easygoing, do things when they come, I can handle it, like that kind of a person. But I think, and I've realized that, that can also add to your stress. So I think being the planner is not such a bad thing. So yes, so I think time management is something that you have to learn a
Hmm.
lot, because again, that is something that's never taught to you. And so I think you learn that with time. The other challenges, I think, is because in the NHS, I think a lot of people, they have expectations that we cannot always meet. So if somebody is worried about something, they want it seen right now, they want the scan
Then and
right
there,
now.
yeah.
Yes. And I can understand that if you're a patient, you want things sorted quickly. But I think sometimes it's a challenge to explain to them how the NHS system works, and we are triaging you. And if we thought it was urgent, it would be seen. But yeah, it depends on how good you can convince and reassure them that, you're not forgotten. It's just that it's going to take time. So I think most people know that they don't like it, but they accept it. But some people who maybe are too worried, they sometimes can be challenging. So yeah, so that's
As I understand, the system works very differently. So, a little bit of comparison based on your experience with the Indian medical system and UK medical system.
Yeah, so I think the biggest difference here is that when you clock off from your job, from your hospital, even as a junior doctor or as a consultant or somebody, when you're finished your work, then you will not get any phone calls, which I think is very different to India, where you can get phone calls at 10 o'clock, 11 o'clock, 12 o'clock at night.
A doctor is always a doctor, 24 by 7.
Always, always. So I think, that is a very big difference, because you are actually switching off from your job. You still have to do other things, but you're doing that out of choice because you want to learn, you want to read, you want to go on a course that you're doing on your own in your own time. But otherwise, I think that is something that's very different, which so I think you can have a good family and
Family.
work life balance. Though I do feel nowadays, maybe I hope I'm right, but I think in India also people are getting very conscious. Doctors are getting conscious. I don't know if they can do it sometimes, but they do try and keep things a little bit. They delegate.
They're trying hard, but yeah, they can delegate.
Yeah.
Yeah, true. Okay. So, where do you see yourself 10 years down the line?
10 years down the line, I don't that's a long way, but like I said, I would like to be involved in education and university work. So that is where I'm looking into it and trying to find what will help me to get there. But I think I would like to be a bit more comfortable in my role at the moment, what I'm just doing, and learn how to be a better kind of, better person to work for. So yeah, that's probably what I would say.
Yeah. So, how was your journey? If you want to sum up, past 17 years almost after doing your MBBS,
Yes.
how was your journey per se with all the three aspects in the country called UK, your family journey, and your professional journey?
Right. So I'm a person whose glass is always half full. So I'm usually happy in whatever I'm doing. So I would say I was very lucky. It was a very pleasant and a smooth ride for me, because I know, because my husband was already here, so he knew what, where you need to apply for things. So I had a guide in that way to help me. And I was also lucky to get my same rotation in in the same county where we were living.
Hmm. Hmm.
So I think professionally, I think it's been a very educational and challenging. But then, it's a new country, new job. So I think I was open for that. Uh, I think personally, I think it was a big I had to learn quite a few things, because when you're studying medicine in India, I don't know how many girls really step into the kitchen to learn anything, to cook anything. So I think for me, that was a bigger challenge. And I like,
So, as I understand, Dr. Aditi, driving and cooking, two challenges. Medicine was a cakewalk, maybe,
yes.
but these two things, essential for survival, were more bigger challenges
Yes,
for you.
because you are never taught. It's always like, oh, you study. You're okay if you don't come in the kitchen. That's fine. So you're like, okay, but then suddenly you're sitting in this house and you're like, oh my God, it's 5 o'clock. I need to start cooking, and you don't know what to do, where to start. So I think. Before I got married, I had like a crash course with my mom, where I sat in the kitchen and I was writing down everything that she was doing. And she was like, "You've gone crazy. What are you doing?" And I was like, "No, no, I need to write everything so I know what I'm making." And I've still got that book and I still refer to it. And so again, I had a plan for that, which was fine. But I think I found that quite challenging. And I still sometimes do, because, I can't think like, okay, what's for food tomorrow? That's the least interesting thing for me to think about, but you have to. So yeah, so I find it
Yeah.
challenging even now. But yeah, my
And
husband is
on
a big
top of
foodie, so he usually sorts that problem for me. He tells me what to make, which makes my life easier.
and on top of it, there is this thing like you don't get a house help very easily
Yes,
in this country.
yes.
Because in India, everyone is accustomed to, suppose both of you were in India, you may be having 2 or 3 maids to do different chores for you in the
Yeah.
house, but this is not the case there out there in UK. So
Yes.
multiple dimensions you have to address at a time.
Yeah. But
What is
again, I
your
think
take
there's pros and cons to that, is how I look. Because, even if you have got 2, 3 maids, you're managing the maids as well. You have to manage
on
them. So you're still spending some energy. Whereas when you're on your own, it can be much easier when it's just the two of you. I think it gets complicated when it's children and you have to feed them on time and all that. But I think you learn that, but you do get some help, but it's quite expensive to. So you can't get as much help as you do. So as a junior doctor and things, you can't afford all those things. But you're quite happy because it's all new. So you enjoy doing it for the first few years, and then you're like, I don't think I can iron any more clothes today. So again, you have to choose and pick. I'm only going to iron the work clothes. I'm not going to iron
Yeah.
anything else. So yeah.
True. What advice at this point of time, if someone is standing in your shoes right now, getting married to a person who is in UK, what would the advice be to that person, that girls especially? And do you feel if you would have known these things beforehand, it would have made your life more easier?
Uh, I think the one thing is to not try and be perfect at everything. So, you have a perfect house, you have a perfect meal and a perfect job, and you're doing great in your exams. I think that's too much pressure. So something has to give somewhere. And I think when you're coming here as a doctor, I think you're focusing first on your career, making sure you've got a job, you've done your exams. So I think I would focus on that first. I think we feel under a lot of pressure to be up to a certain standard as a woman, to try and have the best and the balance everything perfectly. I don't think it's necessary to do that. It's okay if you don't have the best table laid out for dinner or the cleanest house. I think you need to just learn to kind of balance these things and not put too much pressure on yourself.
Prioritize, maybe. Yeah.
Yeah,
Maybe
yeah.
prioritize and say that I'm not a superwoman. I don't need to be a
Yes,
superwoman
yes,
because I am perfect at what I love and what is my P1. That is my first priority. So
yeah.
you have to prioritize maybe in your life that this is my P1. I'll give my 100% there, but not necessarily then all other areas I'll be giving my 100%. Maybe
Yes,
yes,
yes.
maybe no.
And you have to be okay with that. So you can't just say that. You actually have to be okay with it, because other people might say things, but you can't get affected by that. It's okay. So you just
True.
smile and you say, okay, fine, very nice.
How
Yeah.
much help is needed from your family? What support system is needed? What emotional support system is needed when uh, both husband and wife are doctors out there? And what is the support system like you would require, or you sometimes feel like it is necessary?
I think initially, I think when you first come here, I think the winters can be very lonely and they are very dark because everything becomes dark by about 3 o'clock. And you're just sitting there, and if you're not working, if you're working, then that's fine because your day goes very quickly. But otherwise, I think it can get quite, low and depressing in the winter months. But again, it depends on how you spend that time. So when I was here, I got to know my neighbors quite well, and they were all quite kind of old people who lived there in their 80s and 90s. So they used to love if I used to go to their house and I used to sit there and they used to tell me all their stories. So I think you can kind of keep yourself busy. But I think with time, as you become, so you need to be patient, because then, slowly as you start driving, you have more independence. You can go shopping, and it's quite nice atmosphere once you're out there. But when you're alone, and if your husband's on call and he's not there, I think it can get lonely. But with time, I think you find people in similar situations as you, and you should try and connect and talk to them, and not wait for somebody else to call you. If you're feeling bored and if you're feeling alone, you should just pick up the phone and call somebody. So yeah, so I think that is something that you have to learn. I think when you have little children, I think it's really helpful if your parents, they usually do come when they are very little, but they usually can't stay for that long.
Yeah.
Because again, it's the cold weather and they don't have anything else to do. So I think dads usually get quite bored staying here. But I think it's good to have that support and to keep in touch with them. But otherwise, you can always plan, because you have got childcare, and if you're working, then if as long as you're planning that, it all comes down to planning, and just, yeah, you have to be a little bit more organized, because you can't just do things at the last minute sometimes.
True, 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 true. So in that country, planning is the key word. What I have understood from all of this conversation, that
It is
you
a
have to
big
plan
word.
a lot, patience space, and if suppose someone is in a hurry, how many years ideally the person would take to reach the position which you are right
So, if you are very focused, and if you continue doing what you're doing, so the rotation, usually, if you straight away get into a rotation, it's only a 3 year or a 4 year rotation now that
now?
you do. And at the end of it, you're qualified. So then after that, it's up to you what kind of, job you want to take, or how further up you want to move. And you can focus on that and you can do it. So that's fine. The difficulty sometimes is to get the first job, and to get it in. Like I said, I had to apply to so many places and I got only 3 interviews. If I had not got through that, maybe that would have added another year to my journey. So
Mhm.
yes, so it is like that. But I think at the moment, people always need doctors, and there's always a need for them. So you just have to have that time in your mind that it might take a year. So be prepared for that. But otherwise, it depends. After you've done, if you're doing your physician, if you want to be an MD physician
Hmm,
kind of thing,
hmm, hmm,
and
hmm,
after you've done, that's again, I think, a 4 or a 5 year thing, maybe. I'm not very sure. But
hmm. Okay.
then after that, if you want to super specialize, that's another year. So that's how things
Mhm.
get, your years get added to your,
Added.
yeah.
What you want to do.
Yeah.
So, what is the role of networking?
Networking. So I think I would say there's work networking and there's social networking.
Mhm.
So from work point of view, for me, I would say, because when I started, I was just doing locums. Now again, there's a huge demand for locums as GPs, because people are, there are a lot of part-time people or who are off on maternity leave or things. But then you have to be ready to travel. So you have to
Hmm.
drive whatever 10, 12 miles to that job and then come back. So that's a different lifestyle. So that is the one networking. They get to know you because you're reliable or you're going to the same surgeries, and then it's word of mouth. So that's
Hmm.
how it works for general practice, I think. But socially also, there are some groups that once you stay in certain area, you get to know the groups which are there. So there are some Indian groups as well that you can have. There are some, once you have children, you've got different. I think my social networking was improved because of the children, because they have their, the mums in this
Hmm. Hmm.
year and the mums in that year. And so that was something which otherwise on my own, I don't think I would have ever been able to do. But yeah, so it does help. And now with Facebook and all this, internet things, I think it is quite easy to do if you are that kind of a person. You can.
Okay, Dr. Aditi. So it was nice talking to you. Maybe if someone wants to connect with you, you will be the correct person as it is because you are trying to enter into education field as well. So if I need some advice, I'll definitely come back to you.
Sure, sure.
So it
Thank you
was
so
very
much
nice
for
talking
having
to
me.
you.
No,
My
lovely.
pleasure. And okay, so
Thank you.
have a nice time and good day.
Thank you
Bye.
very much. Bye bye.
Yeah, yeah, yeah. Bye.